If you think about a faucet running and leading to disease, well, public health is where you actually turn off a faucet.
Well, a lot more medical schools are offering the dual MD MPH. And actually it's interesting because they're beginning to look at whether or not they should have some public health course requirements for students interested in going into medical school.
By creating a dual degree program, an MD MPH program, what you do is you train one person who has both the orientation of the traditional physician and the orientation of a public health person. But you don't make schizophrenics out of them. You make people who are unique in that they really are thinking simultaneously about public health and the individual care of a patient on a moment-by-moment basis.
Prior to getting my MPH, I was that typical kind of medical student, resident, physician that I felt like I wanted to take care of patients in my community instead of taking care of that individual asthmatic in the ER. I learned how to look at analyzing what's happening in my neighborhood or in that community to help all asthmatics, or to really make a difference, not just that kid in the ER, but in the whole community, to hopefully prevent more kids from coming into the emergency room, for example, with asthma.
I did more of the non-traditional route, which was that I got the public health degree before I ever got my medical degree. Early on, because my training was in infectious diseases, I worked as an epidemiologist in the State Division of Public Health. So immediately I was able to do outbreak investigations and influenza surveillance at the state level. So that was a very tangible result of getting this MPH degree that I wouldn't have been able to do otherwise.
Will really, I think, give students a whole different perspective. And we see that with our students when they enter our MPH program. And by the time they leave after that year or two, depending on how long they take, is they're changed within their thinking, their perspective, and how they view things. So it's kind of a magical thing to see.
From my experience with MD MPH students, they see the world very differently. They are, to put it simply and with some bias, they are the future leaders of medicine because they can see that the skills that they get out of their traditional medical education will not prepare them adequately to lead organizations and to serve communities.
Doctors, I think, in the future are going to be really responsible for care outside of the office, for intervening in the environment, for thinking about the health of whole groups of people. And so people who have a public health mindset and public health training are going to be a lot better at that, I think, than people who don't. So when you have this kind of a thought process, when you focus on bigger groups, you can't help but be drawn to disparities, to places that are underserved, to groups that are underserved. And so it's my view that actually when medicine as a whole starts thinking about this more, the biggest beneficiaries are going to be those groups.
My goal is to become a family practice doctor in a more rural area, and so an MPH degree could really help in community planning and things such as that. It never gets old trying to help people to stop smoking, help people to diet correctly, and I think those things will continue to be an issue, And I could see myself doing more kind of forest and not the trees kind of things.
As this is a state university, it will serve the people of the state of Georgia by pumping out this very specially trained group of physicians who will be more committed to community, more committed to improving the health status of a population. Ultimately, that's very valuable to the state of Georgia and the people of Georgia.